Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, right, treatment of hydatid cyst. In the treatment of hydatid cyst, actually most cysts are treated by surgically. Most of the cysts are mainly we do surgical treatment is important in most of the cysts. Conservative management. When do you do a conservative management? Okay, conservative management is mainly done in elderly patients. It is done, and it is also done in elderly patients with small asymptomatic dense calcific cysts. So conservative management is mainly done in those elderly patients with small asymptomatic densely calcified cysts. In them we do conservative treatment, because in these elderly patients with small asymptomatic cysts, doing a surgery might be risky, so we do a conservative management in them. So what are the treatment options available? We have a pair technique. What is this pair technique? See, pair technique is first you will do you have many techniques. So we will learn pair technique in a minute. But other techniques which are available are pericystectomy, marsupialization of the cyst can be done. You can leave the cyst open. You can drain the cyst. You can do omentoplasty. You can do hepatectomy. So all these are different procedures which can be done for the hydatid cyst. But currently, the most preferred method of treatment is mainly pair method. That is puncture, aspiration, instillation of scolicidal agent and reaspiration. This is the main preferred method for uh, hydatid cyst. Okay, then what about the surgery? When do you do surgery? What are the when is surgery indications? Or you can say indications of surgery. Okay, surgery is indicated if the pair technique is not possible, or if the cyst is not responding to the pair technique. That is, if you do puncture, aspiration, instillation and reaspiration, if this is not possible, or if the cysts are refractory, or if the cysts are refractory to puncture, aspiration, instillation and reaspiration technique, in such cases we should do a surgery. Or if it is a complicated cyst which is involving the biliary tree, obviously if it is a complicated cyst involving the biliary tree, then we better go for surgery. Then um, in the surgery, you can do a radical resection can be done in the surgery, or you can do a conservative where drainage and evacuation of the cyst are two approaches which are almost equally effective. These two are equally effective. So we have radical resection can be done, and conservative drainage and evacuation procedure can also be done. Pericystectomy, and next, pericystectomy is actually a preferred surgical approach. Among all, pericystectomy is a preferred surgical approach where here in pericystectomy, if this is the cyst, you will remove the cyst along with surrounding fibrous tissue. If this is the cyst along with the fibrous tissue which is present, that is completely removed in pericystectomy. So in pericystectomy, actually here you will remove the cyst with surrounding fibrous tissue is also removed in pericystectomy. Right. If cystectomy is not possible due to any reason, whatever the reason if pericystectomy is not possible, then what do we do? You see, if pericystectomy is not technically feasible, then we can do a liver resection can be done in such cases if pericystectomy is not possible. Then chemotherapy is also available for hydatid disease. So what do you do in the chemotherapy? Chemotherapy like with albendazole and mebendazole can be used, which can shrink the cysts. So drugs like antibiotics or chemotherapeutic agents like albendazole and mebendazole shrink the cyst, and thus these will cause disappearance of cyst is seen has fewer than or less than in less than 50% of cases, cyst disappearance can occur with the help of these chemotherapeutic agent. Then preoperative treatment will also decrease the risk of spillage. If you do a preoperative treatment before the surgery, if you do treatment of the cyst with albendazole or mebendazole, this will decrease the risk of spillage of the hydatid cyst. Then in certain conditions, we can do only chemotherapy without any resection. Chemotherapy without resection or drainage. This chemotherapy without resection or drainage is mainly done for widely disseminated disease where we cannot do a surgery, or even if surgery is done, it won't be that useful, or it can also be done for the patients who have poor surgical risk, that is in elderly patients or those who cannot undergo surgery. In them we can do chemotherapy without definitive resection or drainage technique.
Thank you and thank you for watching.